Hello everyone, welcome back to my channel. Today we are going to do 20 radiology questions under 10 minutes, and today we are going to be discussing about kidney and bladder radiology findings. Let's start. Calcified bladder wall is seen in which condition? Schistosomiasis or schistosoma hematobium. You can see the bladder has a whitish appearance on the rim, and that is due to calcification on the bladder wall. Here also in this image also you can see, and this is due to chronic inflammation and fibrosis by schistosomiasis. Christmas tree appearance is seen in which condition? It is seen in neurogenic bladder. Due to denervation changes, you will find these Christmas tree or pine cone appearance. Teardrop bladder or pear-shaped bladder is seen in which conditions? It is seen in any condition that causes extrinsic compression of bladder, namely pelvic hematoma, which causes extrinsic compression, pelvic lipomatosis, pelvic lymphoma, and any mass effect which compresses the bladder laterally, giving a pear or teardrop shape. Thimble bladder is seen in which condition? What is thimble? It is a small rigid bladder. It is seen in tuberculosis. Thimble is a tiny rigid thimble shaped bladder. See, the small thing is a thimble, and our bladder also looks like a thimble in tuberculosis. What are the other conditions seen in tuberculosis? Moth-eaten calyx, Kerr's kink, putty kidney in tuberculosis, pipe stem ureter in tuberculosis, corkscrew ureter in tuberculosis, golf hole ureteric orifice also seen in genitourinary tuberculosis, caseous necrosis, ureteric stricture, and again last, thimble bladder. Let's see the image. This small rigid bladder is thimble bladder seen in tuberculosis. Keyhole sign is seen in which condition? It is seen in posterior urethral valve. So you can see because of the posterior urethral valve, the posterior urethra is also dilated, which along with this is the bladder and this is the posterior urethra. So this gives a keyhole sign in ultrasound as well as in X-ray. Maiden waist ureters. See, the ureters are pulled to the medial side. It is in the retroperitoneal fibrosis, mainly in IgG4 related disease, because the ureters are pulled medially. Check the head of the check this appearance. It is called the cobra head or adder head appearance. See again, it is like the head of a snake. This condition is seen in ureterocele, which is due to dilatation of the distal ureter inside the bladder. The distal ureter gets dilated, and there will be a filling defect which forms the cobra head or adder head appearance. This is PUJO, pelvic-ureteric junction obstruction. The pelvis will be dilated massively, which forms the pelvic-ureteric junction obstruction, which gives this IVP image. What is this condition again? This is putty kidney or cement kidney, which is seen in end-stage TB kidney disease because of extensive calcification of renal parenchyma. This is putty kidney. This is medullary nephrocalcinosis, calcification in renal medulla and not cortex. See, the medulla of the kidney is calcified. Where is medullary nephrocalcinosis seen? It is seen in hyperparathyroidism as well as medullary sponge kidney. Hyperparathyroidism is the most common cause of medullary nephrocalcinosis. What is this condition? This is Stackhorn calculi. See this stone which is on one particular side. This is a Stackhorn calculi or stroide stone or triple phosphate stone. It is in an infection with urease producing organisms, Proteus, Klebsiella, Pseudomonas in alkaline urine. It resembles antlers of stag, and it is formed of typically magnesium ammonium phosphate or triple phosphate. This is triple phosphate stone or Stackhorn calculi. This is ADPKD, adult autosomal dominant polykidney disease, which is seen in adults. See these small, many multiple cystic lesions, that is autosomal dominant polycystic kidney disease. This is a micturating cystourethrogram. What is the finding here? This is vesico-ureteric reflex or VUR. What happens in VUR? There is backward flow of urine from the bladder. So the from the bladder into the ureter and to the renal pelvis. So the ureter is dilated as well as the renal pelvis is also slightly dilated, which forms the VUR. Drooping lily sign in IVP is in which condition? D for D. Drooping lily forms duplicated renal collecting system, and this is governed by Wiegand-Myers law. So there is two duplicated collecting systems, and the upper moiety, the upper ureter, forms the ureterocele, which forms the obstruction, and the lower moiety forms the vesicoureteric reflex. So drooping lily sign for duplicated renal collecting system. The bear porcine. Can you see the feet of a bear here? It is in xanthogranulomatous pyelonephritis, also called bear porcine. Another question on bouquet of flowers appearance. This is seen in medullary sponge kidney. The medulla is calcified, not the cortex. The medulla is calcified, which forms the bouquet of flowers appearance. Here it is the opposite. The cortex is calcified. The medulla is absolutely normal. This is cortical nephrocalcinosis. See, the fish hook ureter is in which condition? It is in a retrocaval ureter. The ureter loops behind the IVC and this portion is dilated, which forms the J-shaped or the fish hook ureter. What kind of renal tumor is here? You can see a central stellate scar. So this is an oncocytoma or chromophobe RCC, which forms a central stellate scar. Which renal tumor is this one? This is an angiomyolipoma because the density is same like the fat. That because of the lipoma in angiolipoma, it gives this very transparent appearance. And this should be distinguished from a simple renal cyst which has fluid filled. So this shows the contrast density of a fluid. And simple renal cysts are done via Bosnia grading. That's all. We have completed this in 7 minutes. Hope you enjoyed and you learned something. Thank you.